What happened to Marcus? That will never leave me.
I was misdiagnosed back in 2004 with cancer and told I had 6 months to live.
I knew I was getting a cocktail of antibiotics. I did not know that one of them was horribly, unpredictably toxic.
I never really got a full explanation of what went wrong.
Why would he be so adamant, even when he was questioned about it, that I did have cancer? It was his need to be right and not proved wrong.
No amount of compensation will bring him back.
The system seems to say, thou shalt never apologise. And I want that changed, big time.
It's just people being ignored when they need help, or people not being heard when they've got something really personal to say.
Mismedication through to serious things, to death. There's just a whole raft of issues that can come out.
Medical errors occur far more often than one would ever imagine, and when I started reading statistics, my mind was blown because I couldn't understand how they didn't learn from mistakes, why they weren't picking up on things, how they could let it happen, why there were so many needless deaths. Why weren't people listening to the patients when they're the ones who can tell them what's wrong?
It's very important that we hear from patients, we hear about their stories, and we hear about the opportunities for improvement.
We have brought together consumers from all around Australia and health providers and policymakers to work together on partnering to improve patient safety in Australia.
There is this growing global network of patients and providers, patients, doctors, nurses, and policymakers that are all saying enough already. We should have had more improvement than we've seen so far. It's reaching out to this community of people that includes both doctors and nurses who treat patients, people who run hospitals, and then the patients and family members themselves to say, come on, work with us to actually get from words on paper to reality.
It was held in Perth because the conditions were right to hold it here. We had a very on-side Department of Health. We had the Health Consumers Council. We had Steph Newell from the World Health Organisation. So all of those factors came together to make it worthwhile.
Australia has all the right policies in place. You've got, the government, ministers, and the leaders of organizations already saying, yeah, here's what needs to be done, but it hasn't gotten done.
And it's probably time to start from scratch and maybe review the way that we do business and review the way that the community wants to see the health system of the future.
The Who Workshop is an important event in that it's bringing patients' voice to our safety and quality agenda.
It's an opportunity for them to listen to one another's perspectives and to hear their points of view, and also to learn from one another.
I'm here both as a consumer and a health professional.
I'm a doctor at one of our children's hospitals. We're all advocates in our own sense, and we do need to speak up.
Doctors that are here today, I think you're very brave to be here and to function.
The fact that you've acknowledged that you've made mistakes is really good. But doctors should also acknowledge the fact that patients know when there's something wrong with their bodies and listen to them, and then maybe lives might be saved.
We're people, not problems.
People, not problems. Yeah.
We're not a broken leg or chest pain or cauliflower ears or whatever the hell.
We need to empower patients and help them access the health system in a safe way.
I've asked my patients to watch their drip, and they do it gladly. Now, when they've asked me questions and I can't answer it, I've given them a piece of paper and a pen to write it down, and when the doctor comes, ask the doctor. It's empowering the patient. It's letting them take control.
Empowering people, yes, but not actually pushing responsibility onto patients to take their own. We're not the experts. We go for a service. The service is supposed to be given. You don't go to a car mechanic and have to be a mechanic to get the job done.
The healthcare people have to take the leadership sometimes, but there are ways that even people with diminished capacity at the time are able to contribute in some way.
We'd like to take responsibility for our own healthcare if we had the knowledge and the ability to be able to do it.